New Zealand is on high alert after a person tested positive for the South African strain of coronavirus after leaving hotel quarantine. The 56-year-old woman contracted the virus from a fellow returned traveller on her floor after returning 2 negative test results. Close to 30 locations have been linked to her movements. And for more on the developing situation in New Zealand, we're joined by Michael Baker, Public Health Professor at the University of Otago. Michael, the New Zealand case has the South African strain. How concerning is this?
Because, like Australia, we're pursuing elimination. So we don't want to see any cases at all outside our managed isolation and quarantine facilities. And of course, I think in all countries now with these more transmissible variants, it just means that control will be that much harder. So obviously this is a concern for us at the moment.
Should New Zealand be going into lockdown?
No. We now have a very good contact tracing system, and that's very much the first line of defence once we get a case in the community. And that system is now is in high gear, following up all of this woman's contacts. And in addition, there's also a huge promotion of community testing of anyone with symptoms. So New Zealanders have responded. I think we kind of know the drill now, and so people are turning up in large numbers to be tested in Northland.
So you're confident that New Zealand is prepared for an outbreak if this spreads?
Yes, I mean, we have already been through this before, and our contact tracing and other systems work well. The other thing that we should say with this case, they have a clear connection to the border. I mean, they came through the border. So that's very helpful in knowing that there are unlikely to be long chains of transmission in the community that we don't know about. So it's not like the outbreak we had back in August where we didn't know where it came from.
The woman tested positive after leaving hotel quarantine. Should changes be made to New Zealand's hotel quarantine program?
Yes, look, I think every time we see a case like this, it's a reminder to firstly figure out what happened in this case, and that investigation is well underway. And of course, with the genome sequencing, and now there'll be a whole lot of other measures like looking at the CCTV images and so on to see how or what kind of contact she had with a person in an adjacent room to have been infected, and then would need improvements as a result. I think this case will also encourage us to look at what happens after you leave your 2 weeks in MIQ. If you seem to have done everything right and you've tested negative, in that week or so after you've left, do we need to actually require people, for example, to stay at home, to do home quarantine for a week as an additional line of defence?
The TGA has approved the Pfizer vaccine here in Australia. New Zealand isn't set to vaccinate most of the population until the second half of the year. Does this case put pressure on the government New Zealand to roll it out sooner?
Yeah, I think there is pressure. As soon as people in New Zealand see vaccine rolling out in other countries, inevitably there are calls for us to be further up the queue. But I think we are a little bit like Australia, perhaps slightly behind Australia at the moment. But I think there are clearly countries that have a pressing need for vaccine right away. New Zealand has a need, obviously, like Australia, I think, to vaccinate frontline workers at the borders and in the MIQ facilities. But I think there is some acceptance in New Zealand that it will be the second half of the year before most New Zealanders get the opportunity to be vaccinated.